I'd like to bring in a 50-year-old male who has been unable to talk since waking up this morning. On examination, patient is fast positive with right-sided facial droop and generalised sided paralysis. Patient is still unable to talk, GCS of 11 and all other observations are normal. No signs of trauma, and our ETA is approximately 8 minutes.
A stroke can happen at any time of life, but they're far more common in patients aged 60 or older. John King was just 50 when he had his stroke. He woke in the morning unable to move his right arm or leg, unable to speak, and with significant difficulty in understanding what was said to him.
Good morning. Hello, Mr. King. My name's Hayley. Can we just get you into a bed round
At this
the corner?
hospital, all patients with suspected stroke are initially assessed on the emergency medical unit. The rapid ambulance protocol team consists of a stroke unit nurse, a senior and junior stroke doctor, and a radiographer.
Okay, this is Mr. King, 50-year-old male, sudden onset.
Their role is to quickly confirm whether the patient has had a stroke and whether he's suitable for emergency clot-busting treatment such as thrombolysis.
He's got some early changes here within his left MCU.
The stroke consultant leads a team of doctors and is responsible for the day-to-day care of the patient.
Hello.
Hello.
Mrs. King, pleased to meet you.
Hello.
Mr. King, hello. I'm one of the doctors. Professor Robinson is my name.
This begins with
your
assessment,
scan
diagnosis
shows that you
and
have had a
acute and
stroke.
secondary prevention
I'm not
treatment.
sure if you know what a stroke means.
Later, the medical team will also be working to identify, prevent and treat any
In your case,
complications.
because the blood supply has been lost because of a clot blocking one of the arteries.
It's important that all stroke patients receive specialist interdisciplinary care on a stroke unit. In this hospital, the patient is looked after by the EMU team, while a bed is being made available on the stroke unit. This normally takes a few hours. The nurses manage the patient's essential care needs 24 hours a day. They're often the first point of contact for patients and carers, liaising between them and other members of the interdisciplinary team, as well as providing specialist care such as continence, pressure area management and nutrition.
As you can. All I need you to do is press that red button if you want us, okay? Think you can manage that?
Hello, Mr. King. Hayley tells me you've got a problem with your swallowing. Okay, well, hopefully we can make that a bit better. The first thing you need to do is to have a look in your mouth, if that's all right. Can you give me a cough? Good, well done.
Early involvement of
Open
a speech
your
and
mouth
language
for me
therapist is
say
essential
"Ah."
in stroke patients.
Okay, just a little bit further so I can see your tongue.
Mr. King wasn't able to swallow safely after his stroke.
Well done.
The SLT liaises with the dietitians and doctors to help provide alternative feeding methods. She also assesses communication needs and helps the patient use basic communication charts. Later, during recovery, the SLT works with the patient to support all forms of communication.
The good news is Carol, the speech therapist, is quite happy with your swallow, so you can have something to eat and drink, albeit a bit mashed up.
This is all just another day for the stroke team, but for the
What I'd like
patient,
to
this
do
is a
if you
life-changing
can, bring
event.
your husband in something to wear, proper clothes.
John King is a working man earning the family income. To add even further pressure, as a sales manager, much of his income is based on commission from sales. Even with an employer willing to pay him some of his normal wage for some of the time he's off sick, he's not earning the commission that his family rely on.
Achieving those goals from week to week.
What I'd like you to do is to make sure he's always got his arm on a pillow and discourage him from having it across his body.
The physiotherapists are the movement specialists in the team. They assess the patient and give the nurses and carers advice about positioning and handling him both in bed and when he's sitting out of bed. The physios go on to play the key role in starting the process of rehabilitation.
I'll see you tomorrow.
If I just soap up the flannel.
The occupational therapist's role is to enable patients to return to their previous lifestyle. They assess and practice personal and domestic activities of daily living. They also carry out standardised assessment of perception and cognition, as well as assessment and provision of equipment to help patients get back to a level of independence.
I'm just shattered, and I'm not sure he's really well enough to come home yet.
The social workers liaise between the professional care team and the family who will be caring for the patient after discharge. They provide advice on benefits and look at the resources that will be needed from community care teams to look after the patient at home. It's common for family members to worry about how they're going to cope with a partially recovered patient at home. In this case, Mrs. King had to take on extra work to try to make up the shortfall in family income.
And we'll bear these in mind when we think of your husband coming home for the first session.
So you understand that we're doing our very best to get you home?
Each week there's an interprofessional team meeting involving representatives from each of the professions. The IPT meetings are a key part of the care process. Each patient's progress is discussed and plans are put in place both for the following week and for the long term. As the patient progresses towards discharge, the occupational therapists organise home visits to assess how the patient will manage at home and what equipment and care needs to be put in place. The aim will always be to get the patient back home as soon as possible to encourage independence. This may start gradually with weekends at home.
Hello again. Hello. Moments here. Time to go home. Just a few bits and pieces left to give you.
Once everything is in place, the decision will be made at the weekly IPT meeting that it's time for the patient to be discharged.
That explains everything that's happened over the last
With discharge, the ongoing care is transferred from the hospital to the community care team.
And that's it. You're free to go. Okay, thank you. Is that okay there, John? Okay. Let's get you home. Bye-bye then.
Bye.
The very best of luck to both of you.
Thank you so much. Take care. Bye-bye.
Bye.